And I think the third question is probably the most important one, Dr. Peterson. What impact would this have on the reliability of our federal registrar in terms of cause of death? For instance, every year in America, the United States, we have approximately 650,000 people die of heart disease. We have approximately 600,000 people die of cancer. If those deaths are recorded instead of cardiac causes and putting it down as COVID, numerous things happen. One is we might get a false impression that we're making headway on heart disease when we're really not. You might see pharmaceutical companies coming to the fore saying, see, we told you, if you take our drugs, if you prescribe our drugs, put more people on Lipitor, we will reduce the heart cause of deaths. And that would be not true. That would be a corruption of the actual data. There would be all kinds of nefarious opportunities for people to grab a hold of corrupted data and make a case for something that wasn't real. And when I raised that point, I didn't get a legitimate discussion. There was no robust questioning. It was, you're spreading conspiracy theories and you're having the audacity to cause or to compare COVID to influenza. I, like so many other people, suffered from certain personality traits. I'm somewhat skeptical, and medical school taught us to be skeptical. I've always been sort of addicted to context, and I've always thought that if we don't have the context of what we're seeing, we can't really digest what we're dealing with. And I had access to more information than many people did because I was vice chair of the Health and Human Services Committee in the Senate. And so I was aware of much of what was going on. And then in the early days of April of 2020, when I received an email from the Department of Health with a link to the CDC advising me as a physician that they were going to adjust the way death certificates were completed. And without meaning to be any kind of grand whistleblower, I ended up making comment about this on a local TV program that I'd been on the news for. And that traveled
What
quickly.
did adjust death certificates mean?
Basically, in the Minnesota Department of Health communication to the physicians, they said, if you believe that COVID-19 may have contributed to the cause of death, you can go ahead and put it down as the cause of death. And that's not right. The CDC, the CDC for decades has said that our job as physicians when we complete a death certificate is to try to identify the initiating event that started the process of demise for the patient. I raised a ruckus and said, this isn't right. I did not get any response from the Department of Health. Instead, I was asked to be on numerous national TV programs. I was asked to be on the Ingram Angle, and subsequently Rush Limbaugh came to my defense, and we had Tucker Carlson show on inviting me. But the bottom line is, this was April of 2020. And in June of 2020, I received a letter with red letters stamped confidential from the Board of Medical Practice advising me that for the first time in my career, my license was under investigation. I think it's important to look a little bit at the timeline. It was in the summer of 2019, which was well in advance of the COVID pandemic, that I had made the announcement that I was done with politics. My wife's health was at an issue, and she was going to have multiple surgeries. So I had already announced that I was not running for re-election. So in 2020, when the COVID hit, I was serving my last year as a senator. I was vice chair of the Health and Human Services Committee. I carried a large insulin bill through and worked with Democrats to get it done, and Governor Walz signed that. At that point in my life, I had made it pretty clear that I was not interested in being in the limelight. I was interested in stepping away from politics and being there for my family. My wife's health was an issue, but I'd also been blessed with 5 grandchildren within the span of about 2 or 3 years, and they were all under the age of, I believe, 4 at the time, or perhaps even under 3. So it was time for me to continue to practice medicine, take care of my wife, and be a grandpa. And I was very content with that. So in terms of some underlying deep-seated desire for fame and infamy, I would say that that's almost ridiculous, because the slings and arrows I ended up taking were hurtful. I had never been in a situation
Right.
like
Well,
this.
you also had some limelight politically speaking, already. The fact that you'd, run a political campaign, you'd been out in public, and you had a reasonable share of public attention. But you're also interestingly well situated because you are a physician of long standing, and also you were a senator, and was it vice chairman of the Health Services Committee?
Yes. And the other
Okay,
thing,
so you'd think that you'd think that all of that would have demonstrated your qualifications to speak on such matters.
Dr. Peterson, when I was a resident, I was named one of the 15 top residents in the country through a Mead Johnson Award program. In the late 1990s, I was awarded a Bush Fellowship to study leadership, computers, and plastic surgery techniques. In 2016, I'd been named the Family Physician of the Year in Minnesota. I've had a wonderful career. I feel at times a little bit like Jimmy Stewart in It's a Wonderful Life. There was no reason for me to put all of that at risk and put myself in a position where people would ridicule me, literally monitor every word I said in order to try to play that gotcha game and hit me with something. It was tough on my wife during that last year in the Senate, the first year of the pandemic, 2020. It was a painful year. I'm not going to deny it. We had schisms within my own family. We had plenty of tears and angst. And it would have been fun to not have to go through that. People have asked me, they said, Dr. Jensen, what was that like? How did you know all this was going to happen? And I've told people, I didn't know. Quite frankly, I feel a little bit like Jonah in the Old Testament, where he was asked to do some tough duty in Nineveh. And he said, no, thanks. I'm going to take a cruise on the Mediterranean. That's what I feel like. But then this whale got in the way, swallowed me up and spit me out on this pathway of ridicule and, if you will, focus on everything about my background. And it was tough to go through. The Minnesota Board of Medical Practice, in their first investigation of me, pointed out that there had been allegations that I had spread conspiracy theories and I was providing reckless advice by comparing influenza to COVID, which, by the way, is exactly what Dr. Fauci and other leading speakers to the narrative had done. But I think the pattern of behavior by the Minnesota Board of Medical Practice attests to your concerns, Dr. Jordan. Investigation number 1 came at me with allegations, and I responded and received a letter. It was dismissed. Investigation 2 was similar. Investigation 3, I was never advised that there was a pending investigation or that there were allegations on the table. I was simply sent a letter by the Minnesota Board of Medical Practice indicating, oh, by the way, further allegations have come in. They have been dismissed. I was not even provided an opportunity to respond. Investigation 4 went back to the first 2, where they investigated me, I responded, they dismissed them. But investigation number 5 is where it gets interesting. The first 4 investigations, I elected to treat them like any regular family doctor in the trenches would do so. So I read the allegations, I responded to the best of my ability, I provided a narrative explanation, and I, if you will, substantiated what I had to say with articles and references. So I did that myself, and that took literally hundreds and hundreds of hours with each investigation. The 5th investigation was put forth in November of 2021. I was in the middle of a governor's election race. I was one of the leading candidates for the Republican Party. And when I received that investigation, I was asked to respond. I did. And that time was the first time I was asked to provide patient records. That made me very nervous, violating patient confidentiality. So I was meticulous to making certain that I de-identified whatever I sent to them. The other thing that went with that was I made the comment that I had used off-label medications for a handful of patients when asked to do so in exceptional situations. That really seemed to change the nature of what was going on. At that point in time, the Board of Medical Practice came back to me and said, okay, we're not sure that we like where you're at here. We asked for a response. You gave it to us. We've asked for more information as well as patient records. I submitted those. They said to me, we've received your records. And that's where it stopped. And it stopped there for a full year. With the 5th investigation, when it went on for a full year, then the election took place and I lost. And 2 months later, I got a letter from the Board of Medical Practice providing additional allegations based on exactly what you said, based on my response to the fifth investigation, including patient records. Now I was being accused of having handwriting that wasn't always as legible as some reviewers would have liked. Now I was being accused of, well, you also did this and you did this. And by the way, you did this. And at that point in time, they said, we're not accepting your written responses as good. We're now asking for a notice of conference. That meant we're going to meet with you. And at that point in time, I said, I probably need to get an attorney. And I got a good attorney out. Mr. Greg Joseph is an attorney in Minnesota who's done a lot of different kinds of law, but has really landed on understanding, I think, the nature of that line between professional conduct as it relates to patient care versus free speech. Now, in the United States, I don't believe that line has been determined with precision. And that's one of the remaining questions regarding my situation is recently we did have that conference with the Minnesota Board of Medical Practice. And I don't mean to get ahead of myself, but 18 allegations were being addressed at one time. They were from soup to nuts. It had to deal with masks. It had to deal with vaccines. It had to deal with comparisons of COVID and influenza. It had to do with how we complete death certificates, how we remunerate hospitals and doctors based on diagnosis codes used. It ran the gamut. But in the end, when the Minnesota Board of Medical Practice says we're dismissing all of the allegations, at that point in time, we still don't know that critical question. Where's the line between professional conduct and free speech? Because I would submit that physicians get to be wrong. If we say on a Monday that this is what we think, perhaps we say something like this: eggs have cholesterol, you have high cholesterol, you should not eat eggs. And maybe 4 days later, we come across material that says, gee, eggs aren't so bad. So I tell my patient, you know what? You can eat eggs. Now, is that misinformation? Perhaps. Is it disinformation? Certainly not. But the bottom line is, as a physician, if I make those comments in the exam room, or if I make those comments on stage at a meeting, a rally, or perhaps a church event, either way, I get to make those comments.